can really see how year on year that the effect of the war has really decimated so much of what was Yemeni society. The public health infrastructure is collapsing, the water and sanitation infrastructure is collapsing, more and more people are struggling to find food, less and less people have jobs, and so together all of these different factors are really decimating what was a very functional country. MSF has been working in Taiz now since the beginning of the conflict, and actually we have activities and we support health facilities on both sides of the front line, which cuts right along the edge of the city of Taiz. We have a large mother and child hospital in Taiz Hoban, which is just outside of the city, and we support multiple hospitals inside the city. And the impact on the population is clearly palpable, which either side of the front line. And we see a huge need with regard to civilians injured by the conflict. We see a huge need with regard to children who don't have access to secondary healthcare, inpatient healthcare. And we see a huge need with regard to women having a safe space in which to deliver. And that's what this mother and child hospital really is able to meet the needs of a huge population that's not just those in a small district around, but from neighbouring governorates even, because there really is a lack of functioning hospitals, especially secondary and tertiary care. The people of Yemen are both directly and indirectly impacted by the conflict. In our hospitals, civilians coming in injured from the conflict, and people are being killed and injured from the act of war. But also the infrastructure that everyone else relies on is gradually eroding. And that's schools, that's hospitals, that's water and sanitation infrastructure in the cities, that's roads, that's transport. The buildings are being damaged, that hospitals are being damaged, that people don't feel safe outside of their homes. Year after year, there's less ability for people to be able to respond to these really strong stresses that are impacting their lives. And you can absolutely understand how difficult it is for the population to go about their lives and look forward with some sort of hope for a resolution.